Thank you, Mr. Speaker. House Bill 1677 passed the House unanimously in December to update references to the Human Services Code from child daycare to child care. This bill was amended in the Senate with the 2018 Human Services Code language. The following changes were made. It directs the Department of Human Services to work with the Department of Education to establish a coordinated care pilot program in schools to better serve children's human services needs. It continues medical assistance day one incentive payments to those private nursing homes to take Medicaid-eligible patients. It also requires DHS to submit an amended state plan requesting the authority to provide non-emergency medical transportation services utilizing a statewide or regional full-risk brokerage model. It directs DHS to establish Medicaid outcomes-based programs for hospitals and Medicaid managed care organizations in an effort to put a higher emphasis on outcomes and care management in the Medicaid program. It requires DHS to include information on the LIFE program when educating or notifying an individual about long-term care services and supports. It extends the requirement on providers to submit documentation of their cost for services which have been provided to children receiving out-of-home placement services. Lastly, the bill extends the hospital assessment to June 30th, 2023, and establishes separate assessment rates for both inpatient and outpatient revenue. The bill passed the Senate by a vote of 49-0, and I ask my colleagues for an affirmative vote on concurrence. Thank you, Mr. Speaker.